Hello, I'm Dr. Brandon Gardner. I'm here with my friend Dr. Scott Coates. Dr. Scott is a retired dentist and he has a lot of information, a wealth of knowledge about mandibular repositioning splints. That's what we're talking about today, splints. And he's been kind enough to share that knowledge with me, and we're going to talk about that a little bit today. Now, we all have jaw joints, the TMJs, we all have muscles and teeth, and you've often said that's kind of like a stool, three legs of a stool that need to be stable. Tell us about that.
Yeah, everybody's mouth has a little bit of instability, and that's normal, it's natural, and the body can tolerate a certain amount of that. No big deal, no problem. However, as you get further in life, third, fourth decade of life, if those problems that were small when you were 20 start to magnify, now you get into troubles. And the bottom line is the three-legged stool is wobbling. And when it starts to wobble, that sets up even more wobble. It just gets worse and worse, faster and faster and faster. So we don't see these problems in 6, 7, 8, 9, 10-year-old kids. We start to see them in 20, 30, 40-year-old people big time. And it's just an accumulation of that wobble over time.
So that wobble, when the joints are out of whack, they're not stable, that causes problems for a lot of folks.
Right.
What are some of those problems that we see?
Joint noises. If your joints are popping, clicking, making funny noises, that's an immediate problem. You need to at least talk to your dentist about it. If you have pain, pain is a great motivator. People come in with pain. Headaches, especially here, back of your head. All the things that a lot of times you go to the chiropractor, the neurosurgeon, or the neurologist for, it's coming from your stool being imbalanced and you're just basically grinding like heck. The other thing is sensitive teeth. Hot, cold, pressure sensitivity, all of those are issues that tell you you've got a fulcrum point and you're rocking off of that one tooth, and that's why every time you put something on it, it hurts and gives you an ouch. Broken teeth, cracked teeth, all of those things are telling you I got too much force in my mouth and it's not getting handled properly.
You know, see a lot of patients, lots of them come in with pain in the jaw, headaches. Lots of them come in with busted up teeth or worn out teeth,
right,
or their gums are receding, or they're sensitive. But these are different problems from a similar source, I guess you could say.
Yeah, they are, and it's because everyone's different. Everyone's body is different. Sometimes men have really strong joints and pretty good muscles, and they don't get that upset, but their teeth are just cracked and flattened. And we just look and go, how are you handling that? But they do okay. And other times we'll see some women that don't have a lot of wear in their mouth, but their joints are so inflamed and in so much pain, and it's really a problem. But it's everyone's chain. Whatever the weakest link is, that's where the chain breaks, and then that's where the symptoms will start to appear and usually get you to go and see someone about it.
I learned a lot about splint therapy from you, and how does a mandibular repositioning splint help those patients, both those that have worn out teeth and they're busting them up, or they have pain?
Yeah, what it does is we're trying to just rebalance the system. We're trying to restabilize the three legs of the stool, get them the same length. That's it. It's just that simple. Well, how can we do that? We can't do anything to this joint or this joint, okay? We can't get to them, all right? But we can do something to those teeth, and we've got two choices. We can either rebuild the teeth, rebuild the mouth, and that's about a $40,000 price tag and a lot of tough stuff. Or we can put something in there at night to wear that in effect rebuilds the teeth and gives the muscles and the system the ability to remain stable. Because all of the issues and all of the problems are occurring at night when you sleep. That's why a lot of people go, I don't grind my teeth, I don't clench my teeth. You don't when you're awake, but you do when you're asleep. Ask your spouse, they'll tell you. You're grinding your teeth, I hear you at night, it wakes me up. So that's when all the problems occur. That's why we put this thing in as a nighttime appliance. It makes it very easy to wear, compliance is high, patients absolutely love it.
How's it different than a night guard? You know, lots of people hear about night guards.
Sure. And night guards are used a lot of times, and basically they're just thick pieces of plastic that kind of are formed over the teeth. All they do is separate the teeth, that's it. They don't do anything to stabilize this joint, or the muscles, and eventually you'll quit wearing it because it hurts to wear it. You're tearing up your joints and you're tearing up your muscles. But when you wear a mandibular repositioning splint, we are giving the muscles the opportunity to start to go, and relax at night when you sleep. Not get upset, not come in and cause all kinds of ruckus in the system.
That's the coolest part about it,
Yeah.
splint therapy, is it allows your body to heal itself, to relax.
That's a good point.
We've been talking about mandibular repositioning splints today. I'm Dr. Brandon Gardner of Gardner Springs Dentistry. If you'd like to learn more, check out our website, gardnerspringsdentistry.com, or on Facebook. Scott, thanks for being with us today.
Thank you very much, Brandon. My pleasure.